South Africa has been hit by its first cholera outbreak in 14 years. Cholera is an acute diarrheal disease caused by eating contaminated food or drinking water. The number of people killed by cholera in the country has risen to over 20. We'll get the latest numbers in just a short while, with more than 200 other cases reported. Joining us now via Zoom, let's chat to Foster Mohale, who is the Director of Communications at the National Department of Health. Foster, great to see you. Thanks indeed for your time. What do we have in terms of the latest figures there? I understand that may have been more deaths with regard to this cholera outbreak that some parts of the country are experiencing.
Good morning to you, Griselda, and good morning to your viewers at home, and thanks for this opportunity. Yes, as the Department of Health would like to confirm that the toll with regards to the cholera outbreak or mortality stands at 26. This is the number as of Friday late in the afternoon. So we're still trying to get the updates from the NICD and also from the affected province.
All right, we seem to be having a bad line to Foster there. We'll ask our colleagues to try and get him back on the line. If we don't succeed via Zoom, we'll try to obviously take this via telephone, but certainly very important information that is coming through the health department now, confirming that 26 people have died as a result of this cholera outbreak. I'm not sure if we have Foster on the line. Are we going to a break to try and establish that line? All right, I understand that we have Foster back on the line. Foster, apologies for that. If you could reiterate the death toll figure again. We seem to have been having challenges with your line there.
Yes, no apology for that. The network connection is on my side, but I tried to get the secondary connection. So I can confirm that as of yesterday or Friday late in the afternoon, the death toll was at 26 across the country. Majority of these cases come from Hammanskraal in Gauteng, and plus one in Mpumalanga, one in Gauteng. With regards to positive cases, we are sitting at more than 130, almost 140 cases across the country. But we'll be able to update the country probably tomorrow before the end of the day.
All right, and we're talking about one case in Mpumalanga as well. If I'm not mistaken, Foster, or just correct me if I'm wrong, there had also been incident in the Free State as well, correct?
Yeah, currently the outbreak is in Gauteng, in Hammanskraal, and Free State. Then with one case each in Limpopo and Mpumalanga. But the main outbreak is mostly in Gauteng, Hammanskraal, and Vredefort in the province of Free State.
Yes. The incidents in Mpumalanga as well as in Limpopo, how did those, given that the center of what we're talking about is in Hammanskraal, were these persons in Hammanskraal or anywhere nearby?
The case in Mpumalanga, we are trying to establish the link between the case with the epicenter, which is Hammanskraal, but there's a strong, the possibility that because the area where the patient or the disease was residing is just at the border between Mpumalanga and Mpumalanga and Hammanskraal in Mpumalanga. So there's a strong suspicion, a strong suggestion that the case there might be a direct link between the two cases because of the cross border, just like the cases in Northwest. But with regards to Limpopo, the case so far where there's no direct link between that case and the epicenter, which is Hammanskraal.
Now, that certainly also raises concern, Foster, because if there is no direct link with the case in Limpopo, are you at this point as the health department also making sure that you have plans in place in the event that you have similar cases in other provinces that do not have a direct link to Hammanskraal?
Yeah, maybe just to clarify with the Limpopo case. The Limpopo case, there's the patient is of Zimbabwean citizen. As you know, that some parts of Zimbabwe also experience outbreak, just like Malawi and some parts of Zambia, some parts of Mozambique. So we are still trying to establish if this is not one of these imported cases. As we remember that the first 2 cases in the country were imported from the country of Malawi by 2 women who traveled to the country of Malawi for family gathering. When they came back, they tested positive. So even the first case of Limpopo, we are still trying to establish if this is not linked to the outbreak in Zimbabwe.
All right. Also investigating cross-border, of course, if any of those individuals could have got this on the other side of South Africa's borders. But I'm sure we cannot emphasize enough, Foster, regards to environmental hygiene and hand hygiene when it comes to cholera. Talk us through, what communities can do to try and keep themselves safe.
Yeah, one of the most important preventative method, very cost-effective, is personal hygiene. We encourage people across the country, not only in the affected provinces, as we know that the diseases has got no boundaries. People will travel across the entire country from epicenter to other parts of the country and also parts of the world. So we want to emphasize that we call upon all South Africans to maintain personal hygiene, which includes washing hands regularly with soap and water or sanitizer. Also try to ensure that those who experience cholera like symptoms, we talk about vomiting, diarrhea, stomach cramps and dehydration, they should present themselves at the nearest health facility, clinic or hospital in order for the healthcare workers to be able to assist them as soon as possible, because we say early diagnosis saves lives. So we encourage people to say, please also avoid drinking water or consuming water from sources that like your river, flowing river, your dams, that we cannot guarantee the quality. So try to ensure that adhere to the guidelines that they will provide as the National Department of Health, as other departments, and also as other non-governmental organizations.
Yeah, cholera is also said, Foster, to be caused by contaminated food. I mean, there are people that, fish for a living. They sell some of that fish on the side of the road. How dangerous, if we look at circumstances like that, does that play a role in contaminated water if you're fishing from these streams?
Mm-hmm. No, definitely, because they also discourage people. Remember, some of the food people, just like fish and any other food that you'll get along the street, is not covered. People next to the road, exposed to the dust, exposed to the other form of virus and bacteria. We discourage people from consuming those food unless they thoroughly wash those food. Remember, there are a lot of street workers who are selling fish, others selling vegetables, fruits. We encourage everyone to ensure that they wash this food that they buy along the street from the street workers in order to kill any possible bacteria or viruses, because with our naked eyes we cannot see whether the food is contaminated or not. Some of this food we buy them when we are not even sure of the expiry date, we are not even sure when this food were prepared. So we call upon all South Africans to say, please ensure that whatever you buy on the street, try to wash it before you consume or you cook.
Foster, obviously, hygiene-wise, how vital are sanitizers as well? We've gotten used to that during COVID-19 and other disinfectants, of course, in preventing or killing this bacteria.
Yeah, definitely. Remember, during the peak of COVID-19, we used to preach the gospel of sanitizing. So that's not only meant to prevent the spread of COVID-19, but any other disease beyond COVID-19, beyond cholera, because there are a lot of diseases, bacteria that we live with. So the best way is to ensure that let's maintain that momentum, keep on sanitizing. We also call upon all other public spaces to ensure that let's avail the sanitizer in our premises to ensure that people, our clients, our stakeholders who come and visit our premises from time to time for business, for any other reason, at least they're able to sanitize, because we shake hands with people from time to time. Sometimes when we eat, we don't even wash our hands after shaking hands because there's no water next to us, there's no sanitizer. But at least if there's sanitizer or water with soap, we are able to prevent further spread of this bacteria and diseases.
I mean, if you're talking about shaking hands, then we've seen quite a lot of, the public asking whether this is contagious. You talk about shaking hands and not washing your hands after having done so. Is cholera contagious?
Yes, the cholera is, it is. Remember, you will there are a lot of people who will go to we always encourage, say, please, as you go to after using the bathroom, try to wash your hands or sanitize your hands, because there are many people who go to the bathroom not to wash their hands afterwards. Others is not because of choice, but it's because there's no water provision or sanitizer in a bathroom. So, and those people, if they are cholera positive, once they shake hands or they prepare food and serve you or the family members of the public, there's a possibility of a transmission or infection of cholera to other people. So hence we say, please try by all means to maintain personal hygiene, because good personal hygiene is one of the best ways to protect yourself from getting gastro or infectious diseases like your cholera, your COVID-19, or flu. Therefore, we say wash your hands with soap in order to remove these germs, or you'll be able to kill these germs. So,
Foster, thank you very much indeed. Appreciate your time here on the channel. Foster Mohale, who is the Director of Communications at the National Department of Health.